Our next speaker is coming from Instituto Pedro Núñez. I hope I said it correctly. Ah, yes, she's saying yes, okay. And will be sharing how their organizations support health innovation in Europe. She will be talking about helping startups with regulations and market access. Round of applause for Inés Urbano.
Good morning, everyone. Thank you, first of all, for the invitation to be here in this exciting conference. It's truly a pleasure to be here. And we've heard from so many interesting Sharpas this morning using the imagery previously used. And hopefully this is another institute that can help you developing your companies. So today's presentation is about how it takes a system, how IPN shapes health innovation in Europe. So it takes a system. Innovation in healthcare requires an integrated ecosystem where all actors collaborate. At IPN, we bring academia, research, entrepreneurs, clinical partners, and regulators and investors. Thanks to this unique synergy, we combine our expertise. We are strategically positioned to foster meaningful innovation in healthcare, not only by responding to current needs, but anticipating future challenges. So this is the city of Coimbra. It's the only university town in Portugal. I know some of you already have been there. It's a lovely city. You can see in the top right the old buildings, and it's a good place to visit if you ever are in Portugal. Also, University of Coimbra is the Portuguese university that has been awarded the most funds from the Horizon European project. Instituto Pedro Nunes, that I'm here representing today, was created in 1991 through the University of Coimbra. It aims the promotion of innovation. We hope to build bridges between academia and industry. At this time, we have 46 associates, which include higher education and R&D bodies, public organizations, local authorities, and business associations and companies. In this presentation, I'll walk you through the three core pillars that define IPN's role in shaping healthcare. The first pillar is research and technology development. IPN hosts R&D laboratories, each focused in distant technological areas. We have also an incubation and acceleration of technology-based companies, where we actively support the creation and growth of innovation in technology-driven companies. And the third pillar, we have highly specialized training that offers advanced training programs with a strong emphasis with hands-on experience. Please let me introduce the networks that IPN is actually actively involved in. These are strategic collaborations that place us right in the forefront of healthcare innovation across Europe, giving us access to cutting-edge research, funding opportunities, and a vibrant ecosystem of partners. And in here, you can see IT Health, that is one of the partners for today's conference. So these are the 6 labs that compose IPN. We have LAS, that is Laboratory for Automation and Systems, the one I'm part of, that's mainly focused on medical devices. Then we have LED and MAT for wear testing and materials, LIS for informatics and systems, LEC for electroanalysis and corrosion, Phytolab for phytopathology, and the lab Geo, with Geotechnics Lab. And this gives us access to an extensive network of researchers, mainly from the University of Coimbra. The Automatics Lab is, like IPN, split in 3 main areas. These are research and development, impact test and validation, and medical devices regulation. We support startups and companies in the medtech and digital health sectors through the entire journey, from initial idea to solution validation. By leveraging our expertise across, we help companies transform innovative concepts into validated, market-oriented solutions. The R&D unit, it's the first unit we're going to talk about, and it's actually certified according to ISO 13485, that is the standard for quality management systems for medical devices. And it provides several services to companies. And this includes the development of proof of concept and minimal viable product. We also provide expertise in system design and architecture, ensuring robust and scalable solutions. And we support both software and hardware development tailored to specific needs of each project. So these are our main areas of expertise. Telemedicine with teleoperation and medical robotics and manipulation, and also cognitive and/or physical telerehabilitation with artificial agents, cutting-edge artificial intelligence, robotics, Internet of Bodies, and embedded systems. I'll now show you some examples. This is Robot H. Robot H is our teleoperated robotic system, where you can see here, this is a robotic arm that is being remotely controlled by a physician. So the doctor can be many kilometers away, and the patient can be here in remote areas and still have the exam. This technology helps overcome barriers to ultrasound access in remote areas with limited medical staff, and also enables remote training in ultrasound procedures. This is another example. This is Anya. Anya combines the feature of an artificial interactive agent with smart modular device with integrated sensors. This cutting-edge technology is poised to drive advancements in the digital therapeutics field, providing a robust foundation for the development of transformative solutions. Cognitive Vitra, this white box here, is designed for cognitive training and rehabilitation, while Face Rehab, this girl here, it focuses on facial rehabilitation. This is kind of interesting because at this point, the state of the art is using a mirror to train at home. And by interacting with the avatar, patients can correct their movements and improve much more quickly from, for instance, facial paralysis than they would do if they would will have only the support of a physical therapist. Moving on to the next unit, we have the impact test and validation unit that offers several services, and this more in the preclinical and clinical phase for usability testing, both summative and formative, clinical investigation, software validation, clinical and performance evaluation, and device verification and testing. And this brings us to TEF. TEFs are specialized large-scale reference sites open to all technology providers across Europe to test and experiment at scale state-of-the-art AI solutions, including both software and hardware products and services, such as robots in real-world environments. So TEF will simplify across access to validation, regulatory support, and testing for AI and robotics-based technologies in 2 hospitals nationwide. TEF Health aims to test AI and robotic solutions in real hospital settings, support market access through the regulatory-aligned evolution, and maximize investments efficiency by building on previous work. So it's a good tool. The last unit, the unit that I'm proudly part of, is Medical Device Regulatory Unit. And here we support companies in several areas, namely revising and preparing technical documentation for regulatory purposes, supporting with global regulatory requirements, namely CE marking, the MDA, the MDR, of course, FDA clearance, quality management systems, both 13485, the ISO standard, but also according to the FDA requirements. And this includes products and software, compliance and safety, quality management system implementations, risk management, UDAMED registration, UDI assignment, and notified body submissions. We'll talk a bit now about the incubator. So at this point, we have 28 years of incubation with over 420 companies, 60% of which are still inactive. We have a annual business turnover in the year 2022 of 520 million and a 75% export rate. We also had over 7,000 highly qualified jobs created. And here are some of the services that companies can find in our incubator. You can have the business plan, you can have the logistic services, access to financing, training, technical financial services, access to knowledge, and promotion and network, and international intellectual property. Also, we were one of the world top 10 university business incubators in the past years. So this is a place where, if you are a bamboo, as we saw it before, this is where you will grow our roots. So this is a place where startups and small companies can set up their physical and virtual headquarters and truly benefit from privileged conditions, not only to develop their technologies, but to accelerate their path to market. Through tailored incubation and acceleration programs, we help entrepreneurs turn ideas into scalable businesses. A lot of companies from other countries other than Portugal are virtually incubated, so you don't really need to leave your place. You can be virtually incubated there and take advantage of the benefits of the incubator program. And then when you grow some more and you're in the exponential growth part of the companies, we have the accelerator. With an overall impact quite impressive, so we have 42 companies and with an average growth exports of almost 2,000%, so impressive growth. Also 370% average growth turnover and 189% average growth on employees. So this is a brief introduction to IPN. I'm available for any questions if you have.
Round of applause first.
Oh, thank you. Thank you.
It was a little bit abrupt, maybe, you know, like, ta-da, gotovo, finished, now questions. Okay, so do you have any questions again? If not, you saw Ines, you know Ines, ask her whenever in next 2 days.
Yes.
Thank you, Ines. One more round of applause, please.
I'll be around for a break.